From VOA Learning English, this is the Health Report. 5 million American children and teenagers have attention deficit hyperactivity disorder, known as ADHD. The condition makes it difficult, if not impossible, to stay with a duty until it is complete. Catherine Ellison knows the problem well. Her son Buzz had many problems in elementary school. He could not be still. He was always jumping up and down in class. He did not pay attention. As a result, his mother says he was always in trouble. And his teachers did not like his behavior. Ms. Ellison did not understand why he behaved the way he did. But when he was 9 years old, doctors identified his problem as ADHD. And like many parents of children with ADHD, Ms. Ellison learned she had it too. Peter Levine is a doctor of children's medicine in California. He specializes in ADHD. He says there are many misunderstandings about the disorder. For example, parents often blame themselves. And he says others also blame the parents. Mr. Levine says the first step in dealing with ADHD is understanding the facts. He says one effective way to deal with ADHD is to change the way you interact with your child. Catherine Ellison did. She and Buzz spent a year researching ADHD for a book they wrote together called Buzz, A Year of Paying Attention. Now, she says they spend more time together. She also says she judges her son less and gives him more praise. Buzz is reacting well to the changes. He has fewer problems at home and at school. And he can pay attention to his schoolwork. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. Nearly 4 billion people around the world have serious untreated problems with their teeth. That is what a recent report from the World Health Organization says. Health officials say failure to repair cavities can even lead to social and emotional problems. Wagner Marsens is with the Institute of Dentistry at Queen Mary University of London. He led a team of researchers as part of the Global Burden of Disease 2010 study. They used the information to estimate rates of infection. The report says untreated tooth decay is the most common of all 291 major diseases and injuries. Professor Marsens says increases in tooth decay are affecting sub-Saharan Africa and probably other areas on the continent. He says this increase in tooth decay could be a result of changes in diet as developing countries adopt Western-style diets. Many Western diets are rich in sugar, a leading cause of health problems in the mouth. But in Western countries, water supplies are often treated with the chemical fluoride. Adding fluoride to the water makes teeth resistant to the bacteria that can cause tooth decay. Wagner-Marsens says oral health problems can have a major effect on a person's quality of life. Cavities make eating difficult. As a result, people may eat softer foods that are easier to chew. However, softer foods are often higher in fat. Professor Marsens is calling for an urgent, organized social response to oral health problems. He believes in fighting tooth decay through a healthier diet. He is also calling for the development of new and less costly dental materials and treatments. For VOA Learning English, I'm Mario Ritter.
From VOA Learning English, this is the Health Report. A new report from the United States Surgeon General finds that smoking tobacco is even deadlier than was known. The report says smoking causes birth defects, a leading cause of death among babies. It also links smoking to cancer of the liver and colon, diabetes, and other diseases. The first U.S. Surgeon General's report on tobacco and health was released in 1964. It was the first scientific report to link smoking with lung cancer and heart disease. Now, 50 years later, Acting Surgeon General Boris Lushniak has released a new report on how smoking tobacco can harm health. His report urges more tobacco control measures. The suggested controls include raising the price of cigarettes and banning smoking in enclosed spaces. The new report calls for research on whether reducing nicotine in cigarettes could help people stop smoking. Dr. Lushniak says studies have shown that smoking can cause diseases such as diabetes and rheumatoid arthritis. It also has been linked to an increased risk of tuberculosis and death. One of the most troubling findings is that women are now as likely to die from smoking as men. A woman smoker's risk of lung cancer is now the same as a man who smokes. And more women die from chronic lung disease than men. Those who do not smoke are at a higher risk for stroke when left unprotected from tobacco smoke. The latest research also shows the chemicals in tobacco smoke can harm brain development in a fetus. The Surgeon General supports more anti-smoking media campaigns and more help for people who want to stop smoking. For VOA Learning English, I'm Alex Villarreal. From VOA Learning English, this is the Health Report. A commission created by the government of Cameroon to study the healthcare system says most doctors have not been well trained. The commission says schools that train doctors do not have the resources to do the job right. It says healthcare in Cameroon is simply bad, and many patients die because of poor services. A reporter for VOA recently visited some hospitals and doctor training institutions in the capital, Yaoundé. One woman's leg was dislocated in a motorcycle accident. She screams for help in front of the Central Hospital, one of the largest hospitals in Yaoundé, but nobody helps her. Situations like this happen often in most Cameroonian hospitals. Nearby is a 55-year-old woman. She says she has come to tell hospital officials that a doctor tricked her into having an unnecessary operation on her stomach. Complaints led the government to create the commission to investigate problems in the healthcare system and recommend solutions. The commission's report says schools for medical workers do not have good infrastructure or laboratories. It says most people become medical workers not because they love the profession, but because they need a way to earn money. 70% of Cameroonians do not have jobs. Dr. Nick Nwanyam manages a training school for medical workers. He says training programs do not have enough laboratories or teachers. Another problem noted in the report is that many Cameroonian doctors received questionable training in other countries. The government says it will close medical schools that do not meet expectations. Some will be suspended and given time to improve. For VOA Learning English, I'm Alex Villarreal.
From VOA Learning English, this is the Health Report. People have known that nuts are part of a healthy diet. Now, researchers say eating a handful of nuts every day is linked to a lower risk of death from several major diseases. Piet van den Brandt, professor of epidemiology at Maastricht University, led the research. He says that eating nuts protects the health of both men and women. Professor van den Brandt adds that you do not need as many nuts as health experts earlier suggested. About 10 grams a day is enough to get the full health benefits of nuts. That's about an average-sized handful. Nuts are high in fat and calories, so eating a handful before dinner could help you to eat less, but eating too many can ruin your appetite altogether. Nuts differ in their fat and nutrient content. Almonds are among the least fatty nuts. Almonds also have calcium and are high in vitamin E, which helps to protect the body from disease. Chestnuts have the least fat and fewest calories. If you do not eat meat, cashews are good. They have lots of protein and minerals, including magnesium, which may help to improve memory. Walnuts are loaded with compounds that may help protect against cancer. They also have good fats and omega-3s. Pecans can help you feel less tired, and pistachios help your hormone levels. However, The researchers found that many peanut butters did not give the same health benefits as plain peanuts. Dry roasted peanuts are better, but nuts are most healthy if you eat them raw. For VOA Learning English, I'm Carolyn Presutti. From VOA Learning English, this is the Health Report. If asked what was the most important health story of 2014, there would be little debate. Ebola has killed more than 8,000 people and infected more than 20,000. These numbers come from the Centers for Disease Control and Prevention in the U.S. and the World Health Organization. But this is not the first time the world has heard of Ebola. Every 10 years or so, it would appear in African villages and kill people. The Ebola outbreak that began in 2014 is very different than all that came before. This time, Ebola sickened thousands of people in West Africa. The Ebola outbreak began in rural Guinea, spread to the capital, and crossed into Sierra Leone and Liberia. Misunderstanding, miscommunication, and fear grew with the number of cases. Governments answered that fear by putting infected people in restricted areas. But they also increased education efforts. Today, health workers continue to go door to door looking for possible cases. Ebola has shown the weaknesses in healthcare systems in some of the affected countries. VOA Learning English spoke to a doctor who got Ebola while working with HIV/AIDS patients in Liberia. Dr. Rick Sakra says a broken healthcare system is the biggest issue in Ebola-affected areas. But there is progress in efforts to fight the disease. French researchers are developing an Ebola test to provide results in 15 minutes. The current Ebola test takes 24 hours. Japan and the U.S. are also working on faster tests, and Swiss researchers are trying to develop a vaccine to prevent Ebola. For VOA Learning English, I'm Carolyn Presutti. From VOA Learning English, this is the Health Report. Electronic cigarettes have been advertised as a safer choice for smokers than tobacco. E-cigarettes contain the drug nicotine, just like traditional cigarettes. But they do not use tobacco, and you do not light them. They operate on battery power. Recently, poison control centers across the United States have reported an increase in telephone calls about e-cigarette poisoning. Most of the phone calls are from people worried about children who played with the devices. The Centers for Disease Control and Prevention says it received 215 calls about e-cigarette concerns last February. More than half were about children ages 5 and younger. The devices apparently had made them sick. Tim McAfee is director of the CDC's Office on Smoking and Health. He says the federal government does not control e-cigarettes, yet he confirms they contain liquid nicotine, a well-known danger. Mr. McAfee adds that the most common way an individual gets poisoned by nicotine is when it gets onto the skin, in their eyes, or is swallowed. Even a small amount, he says, can make a person sick. Nicotine poisoning can cause stomach pain and a feeling of unbalance. Headaches and seizures are also signs of nicotine poisoning. Too much nicotine can kill. E-cigarettes do not contain hundreds of harmful chemicals found in cigarettes. So the U.S. Surgeon General has suggested that e-cigarettes may be a useful tool for adults trying to end their tobacco dependency. But Tim McAfee worries that young people may think electronic cigarettes are harmless. They could become addicted and then start smoking real cigarettes. For VOA Learning English, I'm Carolyn Presutti.